Hi, everyone, and thanks for the kind invitation to come here to talk about lung cancer screening situation in Latin America. Well, this is such a great opportunity to transfer the knowledge in this particular topic about the situation in Latin America. As Claudia just mentioned, you guys were there a few months ago, and I think that being in each scenario and knowing how is everything going, just as at the same place is a very good experience, and we really appreciate your presence there. When we started this initiative in Latin America, we wanted to know what's the actual situation in our countries. So we made a survey which results were published in the JTO in 2023. And what we asked for the people who answered the survey was particularly just 5 questions. Do you have MDD in your center? Do you have a screening program in your center? Are you in favor or not in favor of screening? And do you have access to a lung cancer screening program? The survey was answered by a big amount of physicians. Most of them were pulmonologists. You know, Sebastian Lamotte, the person in charge of the survey, is a pulmonologist, and a big amount of the people included in his team are pulmonologists, so maybe that's the reason to have a lot of pulmonologists answering the survey. Thoracic surgeons, clinicians, oncologists, and other specialties. Most of the people who answered the survey was in Argentina, Mexico, Chile, and Colombia. The rest of the country are less represented in the survey. Most of the people that answered the survey lived in cities where the population is higher, more than 1 million people in their cities. And the risk factors that they included in their lung cancer screening programs were the typical one that are used, for example, here in the United States: more than 50 years, more than 20 years of tobacco exposure. And some of them were using the criteria that you use in NLST, but most of them were updated with the actual recommendations. Other risks than tobacco exposure were taken into account. For example, in Mexico, the lung cancer screening program includes population without tobacco exposure. And most of the people answered that they actually had a multidisciplinary discussion at least once time a month. And I think this is important because, you know, in the ATS recommendation about lung cancer, establishing lung cancer screening programs, one of the recommendations is to build from something. And one of the structures that they recommend to build from is a multidisciplinary care discussion. So we wanted to know if this is having a multidisciplinary care discussion was a good idea to establish a lung cancer screening, and maybe the answer is yes, because most of these centers actually do have a multidisciplinary discussion available so far. Most of the people that answered the survey did not have a lung cancer screening program in their centers. In favor of screening, most of the people was in favor of screening, and if they didn't have a lung cancer screening program in their institutions, they were able to answer if even though they do have the chance of transfer that patient to another center. Most of the people could do that, but it wasn't available for everyone. And this is what we presented recently in the ISLC lung cancer conference in Barcelona. And what we did with this new information was this information was obtained from a forum that we had last year in Santiago de Chile in the scenario of the Latin American Conference of the Thoracic Association. And what we have in Latin America is a lot of countries with lung cancer screening programs available. Costa Rica, for example, has one private center and one research center with low-dose CT as a diagnostic method to lung cancer screening, but they do not have a national screening regulation or public policy or a national screening campaign in their countries. Dominican Republic is doing something called indirect screening. We were not able to have a deep knowledge about what is indirect screening, but what we suppose, talking to some of the pulmonologists there, is that they select patients with pulmonary nodules from CT scans that are performed for other objectives. For example, the quantification of calcium in the coronary system and things like that. But the answer is no when they talk about national screening regulation, public policy, structured low-dose CT reporting system, or national screening campaigns. In Panama, Salvador, Nicaragua, Honduras, and these are the countries from Central America that do have lung cancer screening programs available, but they do not have national screening regulations, public policies, or any national screening campaign. In Colombia, we have 5 private centers with lung cancer screening programs. We include low-dose CT scan, pulmonary function test inside the lung cancer screening program. And in Brazil, which I think is the country that has advantage in this topic, because they're doing it with the support of I-ELCAP, Claudia and David from a few years ago. And what we know is that they have public and private centers, one mobile unit, and they do have public policy and national screening regulations. The rest of the countries, but not Mexico included, they do have 2 private centers, 2 public centers. They also include pulmonary function tests in their lung cancer screening programs, but they are also including microRNA as a method to capture more information about their lung cancer screening subjects included in their programs. They also have a program that includes not only people with tobacco exposure history, they include a lot of people with wood smoke exposure, and they do have a big cohort almost 1,000 people in this particular selection criteria method for the countries. Some other countries, they actually don't have any lung cancer screening program. Venezuela doesn't have a national screening program, no public policy, no structured low dosity reporting system, no national screening campaigns. And some of the countries are having some issues related with the way to keep the information. I think that the screening priorities in Latin America are the same that what we mentioned a month ago in Barcelona. Education on implementing lung cancer screening programs in low resource settings for pulmonologists, thoracic surgeons, and nurse navigators. Training radiologists in a structured reporting of low dose CT scans. I still have issues with my radiologists. They are not reporting low dose CT scans with any structure reported system. Even though that I've been doing lung cancer screening in my institution for almost 5 years, and training leaders on quality indicators in lung cancer screening programs is also a priority for Latin America, because, you know, building programs without a structured way to do it, I think that it's better than nothing, but maybe it's not it's the correct way to do it. For the future, training is needed, establishing lung cancer screening programs, preferably centralized. We need more homogeneous consensus. There are national initiatives, but we don't have consensus in Latin America. And I think with the demographical situation in Latin America, we need to have more screening in people who have never smoked. And our initiative called CRIBA, with the support of I-ELCAP, Dr. Henschke, Dr. Jankelewicz, and their team, is giving futures. This is our first publication, knowing that everything is going in a very good way. And I think that we need more unity in Latin America. Maybe that's the good way to continue doing our work. Thank you so much for this space.